about it though, so you might have to help me on this one. You have already had the content for DKA, you had the lecture, and you studied for it, and you had it on the exam, right? So you were familiar with the process somewhat, and protocol, right? But I don't know if that necessarily made it easier for you when you went down to the CCH rotation. And that's what I need to know. I need to know where that link is, and then how can we set that up differently? And then maybe I can answer your question a little bit more if you can kind of help me fill in that.
We didn't focus so much on the first. I think we will be studying, more about what it was, the signs and symptoms related to acid-based imbalance. I'm just saying for me.
Right.
And, I don't think I honed in so much on the protocol and like
They're not pulling off the information.
We didn't focus on preparing for a patient, emergent case like that.
Okay.
Either. So we got, like you said, local diseases, how, generally not treated, but not emergent and,
Okay, so was it confusing when you did the focus assessment? Were you okay with that? You went down and you listened to respiratory cardiac, put them on the marker?
Yeah.
Okay, so that was the first step, right? You did your focus assessment. Then knowing what to expect on the protocol, which would have included insulin, those are going to be your two biggies, with potassium being a flag, and whether or not you can start insulin, where would you have looked next? Your orders. So when you do a rotation, right, you have an idea what's wrong with your patient. So DKA, you know a protocol is coming, that protocol is fluid, insulin, check, potassium. Knowing that, you scan your orders to see if it has what you need to do the protocol.
I'm gonna say me. I didn't focus on the protocol when I was studying per se. I was just studying on like how to recognize and what are the signs and symptoms,
Right.
but it's not the protocol.
Right. Okay. And there was a slide on it, but of course the instructor has to make it perfectly clear that there's a protocol that's such a big deal, right? For DKA.
Yeah, and I think that's what the miscommunication was, because
Okay.
myself and my partner, like we knew that we had to look at the orders, we knew what the steps were,
Right.
but not knowing, and every hospital is different, not knowing what the protocols are is what threw us off.
Now that protocol is current 2019 everywhere, hands down. I have the research for it.
Tiffany
protocol.
had
And your book.
the PowerPoint of what the
Yeah.
steps were.
Okay. No, I hear you. I'm trying to figure out, keep your hand, I'll call you just a sec. Would it have been helpful, because everything I thought of after that rotation, would it have been helpful if you got with your partner and read the orders before going downstairs? And kind of talked about, this is what's coming, why is this coming, right? So, I think the reason I didn't do that was because I thought you had the content the week prior, right? But now I understand that it wasn't put in a way that taught you to check this protocol quickly, get everything going type of a deal, okay? So good learning tip there, for me as well on how to set this up for you.
So, for somebody like me, I have never worked in a hospital setting, inpatient setting. I've always been ambulatory. So going into a setting that way and not knowing what from what, I mean, I can, do a focused assessment, but that's not my everyday job. And I've been working in specialty for the past 5 years. And so I'm focused on that. So me going in, not knowing my expectations of where what is in this and orders and navigating this EHR that's like complicated and not knowing those protocols.
Right.
I don't know DKA protocols, so it would have helped in LVN school when we would go to clinical settings. We go to the hospital the day before. We review the patients that we had. I knew something of what to expect. In this, I did not. And so I just
thought of something while you were talking. I think Professor Denny is here too, and that's her and I that are putting these cases together. I think what would be a good thing for us to do is maybe come up with 5 patients that are not very sick and have them rotate through 5, just practicing head to toe read orders, write down maybe what you would do. Head to toe read orders, write down what you would do. Maybe to get some practice on a bedside care. Because here's the problem, which I've told you all before. There's this thought that you are are already nurses and have all of this down, I'm arguing for them.
Yeah.
Because I know that you all are giving me this feedback, but I keep hearing that, I keep hearing from higher up, their LVNs already, they have this, they've already had their skills again this summer, just move forward with it.
But they're not making, a lot of places, like hospitals, bigger places, stop hiring LVNs to work med surg.
I agree with
So
you.
long-term care, home
Yeah.
health, that was where our only
Yeah.
options were.
And I'm trying to give you what you need, I'm straddling what's being said by administration and what is being said by you, so I want to give you what's gonna help you.
I was just gonna say that she didn't really teach the protocol, she more taught content based. Like, I wanted us to go over, you know, what signs and symptoms and stuff are. I think if we were taught the protocols and the difference between an LVN and RN setting, because, you know, most of us are okay with like, okay, we can raise the head of the bed, we can do this, but we need to know what our difference is in that.
Right, right.
And we need to
And
know
in
what
our
we're
setting,
implementing.
you move forward with protocol, if that's on there and it was in your order, so, okay, I'm taking all of this and
And
believe me.
even having the information the day before, like she said, piggybacking off of what she said, just to know that it was a diabetic ketone acidosis
Which
patient.
is what you'll do in simulation. Simulation, you will get a prep, so you will know what's coming. Now, if I would have given you the prep the night before, you would just had an exam, would you have actually done it? Be fair, be honest.
Well, we did, the exam was done in our.
On the protocol, we were so busy studying all this content.
Yeah.
That we weren't focusing on
What
what
I
our.
want to do.
By, and by Wednesday.
Okay. By Wednesday, you all were shot.
Yeah, that's it.
You all were like ready to, you know.
We had pharmacology, we had those and calculations.
And that was, we had this discussion, and it was the reason. we
I
didn't
just got to
send it
interrupt other people talking.
Yeah.
That's really how it looks like it's gonna be. So they keep saying that, yeah, we're already nurses, we've already taken NCLEX, we know how to answer those types of questions, but all of our backgrounds vary.
Exactly.
Like, I've only worked in urgent care and I've worked in training, so we're not familiar with a lot of the systems, like using the MAR, the way that we normally would. I remember being thrown into sim lab in LVN school, and we would just walk in, we had no idea, no background from our patient, we just kind of got thrown in there, but they say, well, we're already nurses, well, have you ever been in LVN, did you go to LVN school? I mean, it is different.
Well, what they're gonna say to me, because I bring this up a lot, everybody knows what I talk about constantly. If I say that they find the EHR difficult, their answer is going to be, you had it over the summer. You had all your skills reviewed over the summer, you
We
had
did
everything.
not.
That's what I'm hearing. I know. Like,
This summer was mass chaos and.
Okay.
Yeah, that's not true.
I'm on it, I'm on it. And have a thought, do you have one more thing to add?
I think aside from protocol, trying to decide real time versus sim time.
There you go.
You know, how long do I have to wait before I scan that next blood sugar test?
Well, I wrote it on, remember it said that you must do a focus assessment, wait 20 minutes to check your
Is
lab.
that 20 minutes real time or 20 minutes sim time? I think that's what we,
Oh,
we're trying
yeah, that
to.
would have been real time. Okay, so I'll add that in. I'll add that in. You know, I'm learning how to give very specific instructions, on what to expect there. Okay. If you could email me a note on what you think would be helpful, because that, I collect all of that and try to put that together in what we're building here. Okay? So if you have something specific, like I would like to know, I don't know, more about a protocol before I have to do a protocol in an emergent setting. Something like that, because then I can take you back to, please look at the protocol. I don't know if I did I have that on there? I said prepare. Okay. So if I put, you're going to be in an ER setting, make sure that you understand protocol because you will actually be doing it. Would that have helped?
Because even in a hospital setting, if we're in the emergency room, and say, for instance, we have a patient coming in diabetic ketoacidosis, it's gonna be somebody there that you're gonna already know, you know, what you have coming in, and they're gonna know, like, let's do this, let's do this, let's do this. And so even if you don't have an idea, somebody's gonna be checking those books, somebody's gonna be doing it, and it's gonna be, you're not gonna wait 20 minutes, you're gonna do whatever you have to do. I mean, I think.
tag team.
Right.
It's a tag team.
Okay, okay, good. So when priority is, and you answer those questions, did that start to bring it in at all?
It started making sense, especially you coming by and talking us through what we did wrong, and that helped me a lot understand why we did that first instead of the other, and things like that.
Your drawings.
I can, yeah, because once you did it, that's when I understood. I mean, because you know, sometimes you know what to do, but when to actually do it is when the issue come in. Okay, yeah, I'm gonna get fluids, yeah, I'm gonna get this insulin, yeah, I'm gonna do this, but how am I going to, you know,
You need
the
to answer
process.
that.
And then too,
Yeah.
so I think part of the disease process we were prepared for, but because I studied out of the ATI books, I didn't know the protocol verbatim, but I remember reading, kind of looking over it. But I think the biggest issue was it being communicated, be aware that this is the protocol and you all should know. And I think that's where the disconnect is.
Right, and even knowing like some of the bags were actually labeled as insulin versus the sodium chloride, because we were back there looking for, you know, like, until we realized that, oh, this is ready, two different things.
Well, that's true, I hear you, and some of it does take that learning. It does take a little to go, okay, this isn't a drug, is this okay to give this drug? So that's simulation as well. Simulation is set up for you to practice and probably make an error. And that's why some people don't like sim, so it depends on how you embrace it. I will let Professor Denny talk about that. But everything in sim is designed to learn afterwards. Like, you know, when you debrief a football game, you're playing, you're not paying attention to everything. It's when you sit back and watch the film and go, I get exactly what he just did. So that's what's gonna happen in sim as well. So as you struggle through the CCH rotation, remember, we're always there to talk about things, so I try to draw some things out for you to try to put those pieces together. And then when you do that paperwork afterwards, that's supposed to start, I don't know, solidifying that learning. So, and that's not happening, you're saying?
No, when we do the concept map at the end, that does help me put everything together, like when we're answering those questions. It just sometimes, I'm thinking the EHR documentation, that does nothing for me. That confuses me because I think we're still uncomfortable with the system and knowing what to put in there and it's gotten better, but,
And I'm not gonna lie, a lot of the pressure for me comes from you, because even though we learn it, you grading it so hard that I'm trying to critique everything about it, but I'm not giving myself a chance to learn it because you grading so hard.
I'm
So
great.
that's
You
my
think I'm very hard?
I do.
I think,
I feel like
It's
my
not a
grading,
learning process.
I
I'm
graded
not learning
mine.
because I'm so scared of what I'm gonna get as a grade.
Well, nobody is failing, and it's very difficult to fail in clinical, but it has to be enough to go, I'm gonna relook at this. I'm gonna look at this section and see where I'm actually not getting it. And if it's only worth 1, 2, or 3 points, I'm gonna tell you right now, you're gonna let it go. You're gonna let those 3 points go. And because you're not in clinical, I have to see your critical thinking through another avenue. So I'm definitely having to push there. I know I do, but I have to see it. I have to be able to say that you can go to clinical. You have no idea. The pressure on this side for me to say that you can go to clinical from summer. And that's very hard because it's being based off of virtual and it's being based off of CCH. So I'm really trying to look at, can I actually say that you're ready now to go to a med-surg floor, get these charts, do this care plan, know how to give injections and everything that you need. I'm concerned about it, so I'm really trying to wrap as much as possible. Remember, we did not have CCH. None of this was put in place. You were supposed to be virtual the entire time. That is discussed.
That's why I was saying that, like, even with that, medical record, going through that one day before we go to PCH, knowing the expectations of like what we are supposed to chart on across the board. So some people say, did you intake after, or did you not do this, or did you do that? I think knowing the expectations, so even on your job, you know what you have to chart on and what you're not supposed to.
But that's on the ruler. Remember, it says it all, it says screening, must have all assessment, minimum, it's all right there in that section. And it tells you where to put your site notes, right there. So if you look on your rubric, there's a module that you click on, it'll tell you everything that you're supposed to do for that day.
Okay, so with the intake output, like stuff like that, we can just guess or make up numbers
Well, intake and output would only be important if your patient had an order for strychnine,
Yeah.
which your patient would be paid, yes. So based on your patient care, you're thinking, what else is really important that I have to watch? Remember, you have to have your own output too. So that was a big deal for this patient.
Right.
Okay, so that's what I'm looking for. You're looking for, are you putting together this patient care?
Right, so do we, so it was okay if we made
And
it?
remember, you can always ask me, you can always send me an email saying, I think that this is important because of the patient, am I on the right track? You know, we have to do a lot in making email because you only have 4 hours here. If you're going to those conferences in the you have to do it on off time. So that's fine, you can email me anytime, you can Zoom, I can go over it with you, if you feel like you're still struggling with that, I don't mind. But I just need you all to reach out if you have those questions, I won't know until I actually just break.
But it's due before, you know, if you had questions like one, like sometimes people have like, well, how much output are we supposed to put, what they actually put in, or?
Well, remember, and then even if you didn't do the intake and output, you still may have only been a -1. That's it. Nothing else is big unless you leave it blank. Like if you do no screenings, then you get a -2 according to that rubric. Right, so it's all on there. You need to have something in there. If you're not doing so well at least you get a 1. So I give that for even a partial.
And so, and just to answer, you know, just to follow your question, as far as fluid flow, what I did was just I gave, guesstimate how much fluid we gave the patient.
Right.
And just kind of guess how much
That's
fluid
fine.
the patient
That's fine.
came out.
Yeah, I'm not looking like that.
No,
I'm looking, yeah, I'm looking if you're seeing what is important to this patient.
Yeah.
The one thing that I did notice a couple of times is when you do the patient education. Patient education is huge, but when you're filling out the patient education in educator note, you have to talk about what you're teaching. Now remember, I'm bringing 35 of you, and then I'll get somebody's chart where it's so detailed. I'll be doing diabetic management, I would do this case study, I'll do this, this, and this. So I'll get something that's about this big. I'll accept yours about here, but I won't accept one line for points. Because you can kind of see the range of who's really putting in a lot of time there, and they're hitting all those education notes. If you just say, I would talk about diabetes, well, if they're already a diabetic, you need to talk about non-compliance to their diabetic regimen. You need to talk about working in the sun and drinking soda. You need to talk about other options like an implant. Those are the things that your patient needs to know. It's never that simple. So that's what I'm looking for. And I usually give you notes on that. I'll usually say it's missing something, not enough here. You have it, right, the feedback, when you sign on? I'm sorry, folks, you know, as much as I'd love to give everybody 100%, you've got to look at the range of how these are coming in, 35 different charts. So I'm really trying to get a message to you on think about this a little bit more and think about that. So I'm hoping you appreciate that. Yes.
Okay, so I work in a rehab hospital, so I usually get reports and I look at my orders. Some of the things, if it's a procedure or whatever, may have a protocol. Then after that, I look and review my medication and go from the times I'm supposed to give them. On this scenario, I was confused basically on what medications and what is the specific time that we're supposed to be giving them.
Okay, I see
I
what you're
didn't feel
saying.
like it was
Yeah.
specified, and even after I looked at the orders, I knew what meds and whatever I could do to the patient. But when it was time to give the medications, I was like, which one do I give first?
Right. And that's kind of that weird thing with our time. the
It
start
wasn't
time, right?
necessarily active this time. Last time, I think it said active in the time, so I kind of knew which med to give.
Okay.
But this time, I was like, which med do I give, even when following a protocol? What do I do first?
We just
So
did it.
that's where I was kind of confused with it.
That's the time, let the time to deliver the medication, because the way those are entered, I can't,
Because even if you know the protocol, you know what you're supposed to do as far as nursing intervention, if there's not a specific time, because even in a hospital setting, if I wanna give a med, or I know the patient needs a med, if I don't know the specific time or the PRN time frame that I can give the medication, I can't give anything.
Yeah, I think that's the
So-
difference with the ER, is the ER, if somebody comes in and they're sick, the doctor just writes the orders, it's a now order.
Like a standard order.
Yeah,
But we
well,
didn't
it's not a
do-
standard order, it's
Right.
here's your protocol, here's
Yeah,
everything
orders.
you need. to do that. Okay, good thought. So I need to put some notes on that. And I think what I might do, Professor Denny, tell me if you agree with this, is open up your chart the day before. And then if you look at it that night, kind of
Because
start.
even when we were in LVN school, we would go to the facility, like she said, we would look at everything that the patient was getting, be educated on the patient's diagnosis and medication. So that way, when we went to the facility the next day, the hospital,
Yeah.
we knew what interventions to do for that
Right.
patient.
But not all hospitals are doing that anymore. Not all clinicals are gonna do that. You're gonna show up and get these patients. It's not like that everywhere anymore. It depends on your site. We did it with some even when I was in nursing school, but not all. So it is not a guarantee that you're going to get that this summer. And here's what I'm thinking, because I want Professor Denny to be able to talk to you, because she came up with him. I need to get your emails, send them to me, because I'm going to put that together and see what you need. And I'm wondering if we're gonna have to change up this next CCH rotation a bit, to try to figure out how to give you bedside care on maybe a different level, and then go through a couple of patients. You might have to just rotate or switch. I don't know yet. I don't know yet. So please email me just your thoughts, real quick, something that you think would help you, and I will try to put all that together and see what I can come up with. If I can't come up with anything right away, we'll get the chart done early enough to open it to you, right? But here's the thing you may not like. I'm very clear about it. You may not like that I'm not going to lead you through everything so much, because sin is in you. Simulation wants you to go, and simulation is a fumble. And I'm telling you, the better the sims are designed, the more fumbling you're going to do. Because we learn when we make a mistake. It is just the way it is. When you learn how to drive a car, yes, we know how to work the brake, right? But until you rolled into that intersection, now you really know how to work the brake. And that is how it is. And it is the way the adults learn, right? You remember when you first learned to drive, you were like,
So it should be like this summer, so we should have something going NCI, like that we can be looking at videos and stuff like this summer, like we did those, simulations, you know, like Shirley Williams now. Is it something in here that we can just like, you know?
I will keep looking, I will keep checking. You need to keep letting me know what you're needing, because I am fighting a schedule from administration and you all, and trying to give you what you need here. And we're going into critical care next spring. So you will have the OBPs, which, that's very supportive, but then you're going into critical care, and you're gonna take this jump, which is ER, think past, you've got to be able to do this. And I need to get you there, so please email me and let me think of what I can put together. Okay, that's the most I can promise you in trying to.
Maybe also too, I know, like, we don't need to have too much too soon, because we kind of have to develop that on our own when we get there to the fourth semester. But maybe if it's also kind of like slightly too case scenario based on things that we may be looking for then, you know what I mean?
Which was last time. DKA was actually an emergent. You put your first leads on, you put them on the monitor. I mean, sadly, it didn't put, because some sim centers, you know, they put them on and actually training monitor on that rate. So we're still trying to get more and more where you see live, on what you need. Just email me, let me have a thought, I'll run it past you all, before we do the CCH next time, okay? That's what I, but Professor Denny, let her talk to you real quick about the sim that's coming. And today, by the way, we're doing, you have an option, when she's finished talking, you can go home and do your virtual, it's all individual today. All of your templates are individual, they're not group work. Please do not cut and paste, I will give you a 0 for that, okay? I will not take a cut and paste. It's so easy for me to know that it is not your talking. It isn't the way that you speak. The job was to America. You don't talk that way. So it has to be a summary of what you're reading, which means I don't want you to overwrite. I just want you to get the points in there that are gonna help you. Okay, so the templates are individual work, the virtual, scene is individual, and then you have your questions. Please look at the form, I didn't put it up. It's only the bottom half questions. All right, you see where I changed the points. Your templates that you're gonna turn into me are worth 5 points, and then your questions are the rest.
So with the drugs, I mean, we get like,
It's someone, it's been doing that all day.
somebody calling it.
It's like someone's calling it.
The, like, for the medicine, we just need to
for what the medicine is,
On the template that I just gave you, no, I just said to have your drug book ready. And so I don't want you to write any of the med templates. The only templates you're going to do are the system disorders and the
Right now, I'm saying we're trying to what the medicine is for, what are you
This one before,
say what the medicine is used for?
You're not getting any template. Thank you. Nothing. I just want you to use your drug guide. Here's the thing, folks, when you do your scenario, try to get the right answer. So if you have a question about meds, look the meds up first, then answer it. Don't try to guess, and then you get just as satisfactory. You're supposed to try to do a little bit of research as you answer.
No, we don't do that. We just look them up.
Did I answer this? Okay, so you have a choice today. As soon as Professor Benny talks to you, that you can do your virtual at home, or you can do it here. I'm staying here. Okay, so I will be here again. Don't up and run. You gotta be careful. You want this?
No, not necessarily. I have a very big mouth. It works really well. So simulation, everybody listen up, because I just have a minimal amount of time, because I have to go down to simulation. So the simulated experience that we have prepared for you this semester, I think that you all will really enjoy. Do I have access to their course shell yet?
Your first what?
Their course shell?
I sent it to you, but you can use mine. I'll sign you on.
No,
Okay.
no, I need to upload the expectations.
I sent you the invites.
Okay, for that. I'll go and
Didn't
look.
get to you.
I didn't get an email for the invites, but I'll go in and look.
I'll check with you.
Once I have access, which I probably do now, but I'll go in and upload, probably later this evening when I'm done with simulation, I will upload the simulation expectations as well as the prep work, so that you guys can get ready to come in for the simulations. Now, the prep work is gonna be very basic, like one of the patients, is a psych patient. So you're gonna write up a little bit of information about schizophrenia. So what do you do for that? You know, the pathophysiology behind it. What does that mean when somebody has that disease process? There will be medications that coincide with each diagnosis that I'll have you prepare med cards on. You bring those med cards with you and your prep work to simulation. That's like your ticket into simulation. So simulation is a pass-fail. To get full credit for simulation, you arrive on time. You don't have clinical uniforms, so scrubs would be appropriate, or professional dress with a lab jacket. That you brought that prep work with you. So the prep work should be completed in APA format. Are you guys familiar with that? Okay. So we'll give you feedback on your APA performance as well. So papers that you're writing as you progress in the program will be required to be an APA. So we'll give you feedback on it.
You're good on that now.
They better be. All right, you're good on APA. So perfect, but we'll still provide some feedback. Are you having to do version 6 or 7?
7. We've had to learn some of it for 7 because I was taught 5 and 6, and so we figured some things out now, so they should be pretty good with it.
There were
Go
quite
back
a few
and read your
changes
feedback.
between 6 and 7, but anyhow, so we'll provide you feedback either way. It's not punitive, we just want to give you that information. So we'll do that right after you give us the prep work and after the debriefing. Another faculty member will be checking your APA. And then if you participate in the simulation and in debrief, so you might be caring for that schizophrenic patient, but I'll have 16 students in a room, we're gonna split you guys up. I want the other 15 students to also help participate and facilitate that discussion. So unlike lecture, where faculty gives you the information, in simulation, I will ask user credit questions as many different ways as I need to elicit the information from you guys. So maybe the patient is diabetic, and I might say, help us understand the protocol for administering insulin to a patient. Because there's a very specific protocol, right, for patient safety. The debrief, I think you'll find, is the most robust part of the simulation. When you go in to do that simulation, we ask you to suspend reality. Yes, it is a mannequin. Yes, they are on and they're functioning, and they have lung sounds, just like the mannequins you've been caring for in CCH. But you have to suspend that reality. I won't have QR codes, so if you want to take their temperature, then you simulate what that value is in your mind, because the mannequin obviously is not going to have a temperature. If you are in the sim center, which is across from the nursing labs, that half circle, you can ask the voice, what was the temperature, and they will tell you. There's a difference between the two labs. Lab 4, we have 10 patient beds and 2 faculty running that lab. We might be able to speak for a couple of the patients. That's if we're listening to you while you're doing it. So don't anticipate that the patients will say anything to you, but don't be shocked if they do. On the sim center side, there is a voice for every single patient. So there is a human body sitting behind the glass mirror that you can't see them, and they're going to speak for every patient. There's like a 3 to 6 second delay. So ask the patient the question, give them time to respond, because that delay goes both ways. So when they say it, it's about 3 seconds before you hear it. So those patients will talk to you. So students say that, sometimes they can suspend reality a little bit better because of that communication. In both environments, I think that your learning experience will be very robust. We have 3 patients prepared. You will care for 1 patient, but you will prepare for all 3, because you don't know what patient you're going to get. And I want all of you participating in the debrief. After all, that is part of your passing simulation for the day. And again, no paperwork or anything like that required afterwards. While you're at the bedside caring for the patient, I will have you access the MAR to give medications. And if you want to document nurses' notes, then document your nurses' notes. I'm not going to go through all 35, 36, however many charts there are, to give you feedback on those after the simulation. The true learning happens in debrief. So, as Professor Yurig said, if you've made an error, I ask that when you get to the debrief table that you don't confess that error. It's not a confessional. We can see what's going on during that, but we don't want you to say, oh my gosh, I took the blood pressure around the neck again. I thought that was a regular patient. But it wasn't. And so what I might say is, can you help us understand the best practice for taking a blood pressure? And nobody, and I'm not saying that she's the one that took the blood pressure around the neck. It could have been her. But none of you know who it was. And so, but the person who took it around the neck is going to say, good guess, I thought that's where it was supposed to go. No wonder that patient got circumoral cyanosis. So things like that, that's how debrief is going to go. We'll ask you the questions. We're looking for all of you to participate. You'll have time to prepare beforehand. I'll post those prep questions again later tonight, after I'm finished with the simulation. But I'm going to be doing here very shortly. I'll post those prep questions so you can begin to prepare for the patients whenever you're ready. The simulation will be on December 2nd. That paperwork needs to be in printed format and in our hands on December 2nd before the simulation starts. Failure to bring that paperwork with you results in a 0 for your clinical day. And so we will still give you the option to participate, but we'll have to figure out how we're going to do that.
Well, it's worth 10 points, so if you don't do your prep, it's minus 10 points, you still participate.
Okay, there you go. Any questions so far? I will give you an orientation. If you're in the Sim Center, we'll orient you to the Sim Center. If you're in Lab 4, we'll provide that orientation in Lab 4. The pre-brief, because I'll have you guys sign a consent form, because you have to consent to audio and video. The other thing that you're consenting to is that your prep work is your own. And that will follow you throughout the program, because you guys will come to simulation, I think we once or twice next semester.
Well, we're trying for twice, I'm still waiting on the schedule, they're putting it together.
Okay, so we'll have to figure that out.
Yeah.
So you'll either come through once or twice, and then is next semester the last semester?
Next semester is third and fourth, and then they go to clinical, that's also.
Okay, so you won't come during the summer, because the sim faculty might not be here during the summer. So we'll try to get you in there twice next semester. If you prepare for one patient, you prepare for another one, and you prepare for the third one, you guys combine your work, number one, we're gonna see that, because we look through paperwork for commonalities. Number two, that's gonna result in a visit to the Dean of Students. Who has time for that? Raise your hands. I don't either. And then number three, you're gonna go to Student Affairs, because we want you to do your own work, right? We want you to be prepared to care for those patients, to understand what's going on with them and why the interventions that you've chosen to implement would be effective for that patient. And that prep work's gonna help you do that. Any questions? You guys will, go ahead.
So we have to do a paper on all three of the.
Yep.
Okay. I'll read this paper.
Well, like this big isn't gonna be good enough, because I'm gonna come in and say, your paper's only this big, so, you know, like, if you have 4 sentences for 3 patients, so I'm really gonna hone in on you during the brief, because I wanna know that you have the knowledge.
I mean, enough for-
So, I mean, it has to be enough that when you're reading it, you understand, so it's really based on you and understanding what you're doing with that patient. We are looking for completeness, like you should have, we have to have an understanding, so with a schizophrenic patient, you have to understand that it's a chemical imbalance. That's an issue with the brain. And you can send that patient to counseling, and that's gonna be somewhat helpful, but it's not gonna fix the problem. The patient has to have medication to fix the problem. And without the medication, then all those signs and symptoms develop. They're hallucinating, they're paranoid. And so your prep work should read as something like that. You know, this is the pathophysiology behind it. This is the part of the anatomy that it affects. This is how I'm gonna intervene with that patient to bring them back to health. Because our patients, they're here on that continuum of healthy, but we need them up here. So down here is dead, and up here is optimal level of health. We need to get them moved back up. So in simulation, what we're really watching is your ability to make clinical decisions. Your critical thinking, your clinical decisions, and overall clinical judgment. So what are you doing for these patients? That tells us your preparedness to go out into practice, and as Professor Urick was saying, we have to know that you're ready to go out and practice. Yes, these guys are all ready for clinical. So simulation's gonna help you with that. I think that you'll really enjoy the experience. I think you'll learn a lot from it. Any questions?
Are you more nervous now?
No, be less nervous.
Good.
Because here's the other good thing, if you get out into simulation, you get report on these patients, because I'm gonna tell you, please identify the priority concept for this patient. So you're planning that care for the patient in your mind. And when you go to the bedside, if the patient is asthmatic, for instance, then I would anticipate that if this patient's exacerbating and having difficulty breathing, your first assessment is gonna be respiratory. Of course, we always do the patient's vital signs first, unless it is something that is an emergency, because we don't want to manipulate the vital signs caring for the patient, right? And so if you chose to assess that patient's bowel sounds, then we're going to talk about that in the brief. You know, if somebody says, well, I really think that elimination was the priority, then we'll walk through that and say, okay, well, where's your data to support that that's your number one problem? When you have a respiratory rate that's 28, and you have an SpO2 level that's 89%, and medications and the patient's past medical history, that type of thing. Does that make sense? But if you're stuck, if you've prepared for all those patients and you're still stuck, I don't want you out there on the floor stuck for 30 minutes, right? I want you to move through the simulation. Because the beautiful thing about simulation is I'm going to give you all your RN license when you come in. I will take them all back when you leave. I need you to be RN during that simulation, because I want you out there critically thinking and making decisions for these patients while you're there. You can't do that on your own in a clinical setting, right? The faculty member is going to say, okay, remind me to get the blood pressure, because I saw you forget it in the last one. She really didn't. She just happens to be right there. But I need you to be able to do that while you're in simulation. So in the clinical facility, you can tap into your instructor as a resource. In simulation, even though we're here, we're not. But if you're stuck, then you pick up the phone and you'll call and you say, we'll say simulation operator, you'll say, I'm stuck, and I'll say, I'll be right out to help you. And then I'll talk you through it, we'll get you guided in the right direction.
I'm just curious, do the semester 1 AD students go to clinical?
Semester 1 ADN students,
traditional-
only for 8 weeks.
Traditional, they're supposed to, but COVID stopped that in the spring, so they didn't get to go.
Yeah, spring, kind of put a name on everybody. So simulation's a safe environment, you can make clinical decisions. If you make errors, we'll sim for a second time. How long are they down there, remind me? Is it 2 hours?
Yeah.
So we
No,
probably
they have
will.
a 4-hour day, I don't know how you rotate them.
I could use all 4 hours.
Yeah. I thought you were doing the double.
No, I think we're gonna sim all students at the same time. We're gonna put, we're gonna put half in lab 4 and half in the sim center. So we can do a 4-hour sim. So that'll be perfect. That sounds like a long time to you guys, it'll go like that.
It does.
Because the first 45 minutes or so, we're talking about pre-brief and what are the expectations for the day. Then we give you about 5 minutes to plan your care for the day. And then we do the simulation, which is about 45 minutes. 30, it could be up to an hour. It depends on how you progress through the simulation. We just watch those cues. Debrief is double whatever you've simulated. So debrief is usually like an hour and a half long, roughly. And then we'll go back and we'll sim again. Because if you've made errors, and then in debrief you get all the right answers, right? So you can go back and be very cognizant of those errors that you made and correct them. That helps cement the information in your mind. And then I would like these guys to do a reflection as well. So we have you guys reflect using Tanner's model, clinical judgment model of clinical judgment, however that goes. But basically, that's not an APA format. That's just like your mind. Okay, this is what I did with the patient. These are the decisions that I made. And then after we heard the brief, this is what I would change for the next time I go and care for the patients. That really helps form your clinical judgment. I know we have you guys doing all kinds of papers. I get that. There's a reason for it. In this particular tool, there's tons of research that tells us if these students are giving us a robust reflection, that's helping form your critical thinking as you're going out into the clinical setting. Any other questions for me? And simulation time is
You
fluid.
can always send me an email if you have, sometimes they think of it afterwards, right? So you can always send an email and we'll answer.
And simulation time is fluid because I heard that time factor in there. So, how long do you wait? Once you provide an intervention, how long do you wait to assess the patient or whatever the scenario may be? Time is fluid in simulation. So if we will start out at 7:30 in the morning, that's the simulated time. That sim will start at 7:30 in the morning, then you'll progress through your care. If you have, say somebody needs labs drawn, you get those labs drawn on the patient, and you want those results back, well, you fast forward the clock and you go over the phone and you call for those lab results. If you've given a PO pain medication, fast forward that clock 45 minutes, and now you're doing that assessment. So time is fluid. It's whatever time you want it to be.
Can you upload an example of like what the paper should look like? Or, is there gonna be like a,
As long as you are comfortable when you come into simulation, then you've got enough information in that paper. I don't have an example to give to you.
And don't we usually say a full paragraph? Full paragraph's like 4 to 5 sentences is your minimum to start explaining anything. It can't be just one sentence.
Right, because you're going through a roughly, a very broad overview of what's going on with the patient. And then the nursing care for the patient, the teaching that you might provide for them, the interventions that you're gonna provide for them. What diagnostic tests and lab values are they gonna do for that patient? Now, you don't need 6 pages on one patient. I don't know, if I had to guess, probably a page and a half is probably sufficient. We give you enough room for information. Likely, every student's a little bit different. You might be able to accomplish the whole thing in 3 pages or 4 pages, but it takes you 8. It just depends on the person. All right. Does that?
So all 3 patients are in the same paper, you just kind of do one and the next?
Yeah. You can just put a subtitle for that next patient. Okay, so the first patient is schizophrenic. Second patient has osteomyelitis, and I think the third patient has a respiratory condition.
And we'll just do one patient per sim, or?
Yes, just one. We'll talk about all 3, so you have to be prepared to debrief on all 3. Because we put all the minds together, right? We'll get all the right answers. Every time. Does that clarify what you're gonna go through on your sim day? Okay.
You can always talk to me afterwards.
Absolutely. She's the sim guru. All right, And you
I
can
love
email me if you have
simulation.
any questions, as you're preparing, just shoot me an email. On the expectations that I'm gonna post to you, it talks a little bit about the history of simulation, and then really what to expect for that particular day. It's gonna pass, fail, you'll have that reflection that I talked about, is due 24 hours after, so what time does that come in?
1 to 5 is or something.
Okay, so if it ends at 5 o'clock, then the reflection is due before 5 o'clock. You can put it in at 4:59 if you're that person.
Well,
Sometimes I'm that
they usually
person.
try now, I think by midnight, but you know now you have the next day. right?
Yeah, I'll give you 24 hours to do the reflection. The sooner the better, that's the other thing research tells us. If you can go home and reflect on that day right away, that's better.
You don't have to-
But I also don't want to stress you guys out. You guys are stressing enough, right? Your students and life and work and. All right, email me if you have questions.
Thank you.